Good afternoon, everybody. Welcome. And we said on Friday that we would have news for you today, and we have. And I think most of it's good news. I think it's all good news, really. The first item that we're going to address is the schools, and the second is the stage 2 guidance, procedures, notes, information, if and when, and it will be when we make a decision about what that date is. But the first thing that I'm sure thousands and thousands of people want to know, parents, children, employers alike, is when we're going to open the schools. And the answer is next Monday, the 8th of March. Now, next Monday, the 8th of March. That's for preschool, schools, colleges, other education settings, the like. The whole thing will be open as from next Monday. The only qualification to that is that children in year 10 and upwards will actually go back to school. They'll physically go enter the school gates on the Tuesday, which is the 9th of March. Now, this is absolutely nothing to do with the fact that the UK may have announced that they're going to go, or the British Prime Minister's announced that they're going to open their schools on the 8th of March, completely independent of that. We would not follow what they were doing. We are not following what they're doing. We're doing what we believe is absolutely safe for the children of our bailiwick. And there have been many discussions between the public health team and officers and others in education. Dr. Brink will take that forward as to the protective measures that are being taken, but we're pleased to be able to announce that everybody can breathe that sigh of relief that the children will be back at school in just 7 days' time. And it reminds me of a 1960s pop song from Marianne Faithfull, As Tears Go By, and there was a line in that, I can hear the children sing, and we'll all be able to hear the children sing, hopefully, next week. So that's the first issue. It's a very, very important issue. Information will be going out during the course of this briefing, frequently asked questions, media release and the like. So that will be going out from any time now. Now, the second item is stage 2. And as I said last week, it's the intention of the Civil Contingency Authority to discuss that tomorrow. And all things being equal, we hope that that decision will be taken and that the opening of stage 2 in Guernsey will be relatively shortly. It won't be before the 8th of March because we're not going to open before the schools reopen next week. But it will be relatively shortly because the figures again are good. The trend is going in the right direction. But you've never got this blinking thing nailed because we've heard of the Brazilian variant in places in Gloucestershire and other places in England and in Scotland. We've heard of the fact that in France, very few people, or not enough percentage of the population, are actually at the moment taking the option to take the vaccine. We hope all of those things will change. We hope that we can move forward. We're certainly intending to move forward unless something very, very significant happens. So that's, again, the qualification we make in relation to the schools. But we obviously don't think it will. And again, we have no intention of putting the teachers at risk or the pupils at risk or the parents at risk, anybody at risk. Our prime consideration is for the safety of all those people. Now, again, with stage 2 guidance, you'll hear more from my colleagues on the panel, Deputy Salisbury and Brouard, and the Chief Executive, Mr. Whitfield. All of those will give you various details about how this is going to operate. Obviously, Deputy Brouard will be speaking more about matters relating to health and ancillary issues there too. But the main thing for us all to do is to realise, I know somebody actually said they think I'm quite grumpy when I warn people about behaving and doing what they're supposed to do. Well, I don't make any apology for that because, again, and I've got a mental image of Dr. Brink doing this. There's another song, because you can tell I've been listening to 1960s pop records recently, from Procol Harum, when they talk about turning cartwheels across the floor. Now, I've got a mental image of Dr. Brink doing that when she gives us good news. And we want people to have good news. We don't want the bad news. We don't want to have to go back. We don't have to stall the move forward. So we're saying to everybody, please, please, please maintain the vigilance that you've been maintaining overwhelmingly so far. And of course, in Guernsey, we're still in stage 1. And we're still in stage 1, and we will be yet for a few more days at least. So you must obey the stage 1 rules. And when, not if, but when we proceed to stage 2, although the rules will be different, you must comply with those. We all have to, because it's to the benefit of everybody. Our good friends in SARC are part of the bailiwick. They have already been in phase 2 now for some time. Our good friends in Alderney are moving towards that tomorrow. So as I say, stage 2 guidance will be published. It'll be on the website and published with other information, both in relation to social, recreational and business guidance from 2 p.m. or thereabouts thereafter. So certainly this afternoon, you will be seeing that. So that's where we are. And stage 2 is a really, really, really big step. It's not the final step, because the final step is stage 3. But we are moving towards stage 3. We've got to go through stage 2, which will enable businesses to open, schools to open, far more indoor and outdoor activity. None of it is without risk. Life isn't without risk, but we're moving in the right direction. Anyway, enough of my words. Dr. Bring.
Thank you very much, Hairbrush. And if we go to the first slide, it shows my usual summary of events that have occurred over the last week. And I have to say it's going really well. So it is very encouraging. We've had no new cases for the last 2 days. And indeed, we've had no new cases this morning. So really going in the right direction. But in summary, we've got a total of 511 positive cases from the second wave. Of those, 496 are closed. Now, what is encouraging, of those 496, 495 people have recovered from their acute COVID-19, and one person, as you're aware, has sadly died. That leaves us with only 15 active cases. So a really good trend that we're following. The other situation is with regard to the inpatient status. We still have one person in hospital, so no further admissions over the weekend. So all the parameters moving forward in a very encouraging way. So if we go to the next slide, and I wanted to pause slightly on this and look at the World Health Organization key considerations. And I think it's important to emphasize that whilst we are moving forward, and that's really good, all of the things that we gained, we don't want to lose. And there are some considerations that all of us can integrate into our lives to make our islands a safer place. So the World Health Organization is focused on 3 things, which is location, proximity, and time. And all 3 of those we've considered as part of this exit strategy. So location, what is clear is outdoors is better than indoors. And I presented you some information last week on the last 150 odd cases that we'd analysed, and most of those cases were caused by indoor transmission within households, so almost 3/4 of those. And that's informed our thinking with the exit strategy. Proximity, so how close are you to people? If you don't have to be close, then don't be close. So keep that 2 meters social distancing if you can, so really important. And the third thing is reflect about the amount of time you spend in an individual situation. The longer you're in that place, the greater that risk of catching the virus. So it's that sensible approach to lockdown, which I think the bailiwick has done so well, is that we can think about where we are, so our location, our proximity, and the time we're spending. So if we go on to the next slide, which shows our progression out of lockdown, and we've never considered this in a singular fashion. It's always been an integration between our work-related activities, our recreation and exercise, our social connectivity, as well as education. None of those can be considered independently. They're all interlinking, and we need to consider all of those together. Now, we're progressing to stage 2. We're hoping to progress to stage 2 on a background of a low risk of uncontained community transmission. So as I said, we've got no cases over the last couple of days. The single case we had the day before was well contained. So we really are moving in the right direction. And I think, again, that is a testament to the amazing work that the community's done. But I'm going to focus on the next slide to talk specifically about the reopening of schools. And we've worked really closely with the Committee for Education, Sport and Culture on this, and it's really been a team effort. And I'm so grateful to the support I've had from education. And we've looked specifically at what we can do to reopen the schools in as safe a way as we can. As Deputy Fairbrother said, nothing is totally risk-free, but we're looking at being as safe as we can. So the first thing we're going to have is we're going to have classroom bubbles for primary schools and as well as for year 7 and 9 in secondary schools. In the older students, we won't be able to do classroom bubbles, but they'll have year group bubbles, and we'll be looking at some testing for that student group. Now, we've also said 1 metre social distancing wherever possible. And of course, we realise, particularly in the younger schools, that that's never going to be possible 100% of the time. And I think that's important to acknowledge that there are times when a teacher is going to have to help a young student and so on. And I think that's really important. Sitting behind all of this is our enhanced cleaning regimen for schools. So really thorough cleaning regimen. There's not only normal school cleaning, but it's cleaning of handles of doors, enhanced cleaning of toilet facilities, so to keep the whole facility as hygienic as possible. We're looking at a specific, and we are implementing a specific public health strategy for the testing of staff within education, and as I said, some students as well, and that's going to be really important, and that will form part of our surveillance program. For older students, we're recommending that they use a face covering. This is not by legislation, it's a recommendation, particularly in communal areas. We're going to be looking at a staggered start and finish time. So that goes back to the World Health Organization criteria of proximity and crowds, really important. And there will be a limited public school transport or limited school transport service. And I think that will help us get children backwards and forwards to school. So all of these measures that we put in place are helping us open the schools in as safe a way as we can. So if we go to the next slide, I'm now going to move away from schools and focus on our social connectivity. Now, one of the things I've always said is that evidence will inform our decision making. We won't simply take evidence from another jurisdiction and say, well, let's just apply it to Guernsey. We'll specifically look at evidence for our community, which is why we did that piece of work last week looking at how infections were acquired. So we analysed all of our contact tracing records and did a deep dive as to how local people were getting infected. And as you're aware, just under 3/4 of the last 150 cases acquired their infection through household transmission. And that's informed our household guidance. So households represent the highest risk for us. And what we're saying is that there can be 4 reciprocal households. So the bubble can now extend to include 4 households, but that bubble needs to be exclusive. So that's important. So that's the household-specific guidance. So if we then go on to the next slide, which specifically looks at indoors, and so we've gone from household to indoors, with outdoors being the least risky. So we've rated indoor gatherings as medium risk. And here we've gone back to the controlled and uncontrolled environments. And you will, of course, remember those from our first exit from lockdown. So the controlled environment is where basically we know who's present, where they are within that environment. So it might be people seated at a table where you know exactly who's sitting where. That can be up to 20 people, and you can accommodate more if facilities allow, but that will have to have a specific consideration method statement. What we don't want to do is have a super spreading event and go all the way back again, and I think that's really important. So outdoors we're much less concerned about because of the fresh air, and we know that the virus transmits far less efficiently in an outdoor setting. So those are, if we look at, I'm going to focus, on indoors. So indoors, uncontrolled environments is, for example, when you go into a shop, and there we're saying 2 meters social distancing, and I think that's really important because people stay away from each other in that particular facility. So you've got your controlled and your uncontrolled environments. And now, if we get onto outdoors on the final slide, for outdoors, we're far less worried about that. So it's up to 30 people. It can be an organised event, a controlled event, but we then want to have that social distancing in place. We want to have that respiratory etiquette really central to as we move forward. So as we unlock, nothing's going to be entirely safe. Nothing's going to be 100%. But what we're doing is we're putting all of these mitigations in place so we can progress as safely for the community and unlock our community. So thank you very much, Deputy Fairbrother.
Thank you very much, Dr. Brink. Now, as Dr. Brink has said, safety is our prime concern. On Friday, we'll have with us the president of Education, Sport and Culture, Deputy Dudley Owen. She and colleagues will be fielding, we'll have children's questions again as we had previously, and that was chaired by Deputy Salisbury. So we're dealing that. But now my colleagues will deal with questions arising from the guidance that will be published, that is being published shortly. Deputy Salisbury.
Thank you, Peter. Stage 2 really is a significant step forward towards normality, but it's in this in-between period where we've not locked down, but we're not fully unlocked, but we know the rules do get more complicated, and apologies for that, but they have been designed to enable us to manage the risk of transmission as we come out of lockdown. Firstly, I'd just like to reiterate what Dr. Brink said about bubbles. We're doubling bubbles again, so that means 4 households in one bubble. If you've already bubbled with a household, you can't break that either, I'm afraid. But that bubble must include only those 4 households. Those in the bubble can spend as much time as they like at each other's homes and gardens. They can go out together too. In that sense, the rules for bubbles don't change. They're just bigger bubbles. If someone isn't part of your bubble, you can't go to their house or garden, and they can't come to yours. Now, bubbles don't work for everyone, we know that, and that's one of the reasons that in our current stage, stage 1, you're able to have outdoor gatherings of up to 5 people from outside your bubble, socially distanced. When we move to stage 2, our rules around gatherings are changing too. So keep in mind the rules of gatherings are how we meet up with people who are not all within our household bubble. We're introducing new limits on how big gatherings can be, as Dr. Brink said, with up to 20 indoors and 30 outdoors. Now, that has implications for businesses, and the Chief Executive will speak more about that. But for all of us as individuals, what it means is if we're organising a meet-up with friends outside, the group must be 30 people or less. Where you can confidently keep a record of everyone who's attending, you can have that gathering with social distancing of 1 metre. If you can't keep a record of who's there, it's 2 metres. We'd expect businesses to apply that for things like alfresco dining, but we need you all to be doing the same in your own social lives, whether that's picnics on beaches, going out for walks, outdoor exercise, or anything else. If you're indoors in a gathering, the group must be 20 people or less, and as I said before, can't be in someone's house. Cafes, pubs and restaurants will have additional rules that will need to be followed, which the Chief Executive again will pick up on when he deals with the guidance for businesses in a moment. Face coverings remain a legal requirement in indoor public spaces and public transport, and strongly recommended anywhere else where you'll be coming close to other people. Obviously, we realise that some of the gatherings you'll be having, they'll be eating and drinking, and that is acceptable under the law to remove your mask to do that. The CCA will be looking over the detail of the current face coverings legislation this week to make sure it properly takes into account all the sorts of things we can do in the next stage. But broadly speaking, if you're wondering whether it's something we'll still need to do, the answer is yes. Public venues like churches, cinemas, museums or libraries will be able to reopen in stage 2. The rules of 20 indoors and 30 outdoors apply to them too. Weddings and funerals can also be held with those same numbers of people. Baptisms and communions and events where there's singing or any wind instruments being played are not allowed. It sounds odd, I know, to ban the clarinet, but it goes back to the data of how this variant spreads. And remember, it's only temporary. Swimming pools can reopen, but there will be very strict rules for how they operate, and we'll publish those online this afternoon. Indoor gyms can open too, but they can't hold group classes of any sort. That goes for all indoor fitness sessions like yoga or spinning. I'm afraid none of that will be permitted in stage 2. Where indoor gyms are doing one-on-one sessions, there'll be very detailed rules they must follow, which will also be published today. The simple fact is gyms are an area of potentially higher risk, and so we really need them to stick to these rules. For outside organised sport, contact sport isn't permitted, but training for team sports is okay if it's non-contact. That can be like all outdoor gatherings for up to 30 people. They need to socially distance, and organisers should keep a record of who's taking part and when, just in case we need to contact trace. And I'm sorry that outdoor and indoor children's play areas will need to stay closed in stage 2. And finally, because we know the question will be asked, yes, public toilets can reopen in stage 2, provided people socially distance in the communal areas. and they're regularly thoroughly cleaned. So hopefully that gives you an overview of what stage 2's rules are for each of us. This won't be normal, but it will feel like we're getting there, as the restrictions we've lived under for over a month now are lifted quite substantially. Even though we are moving through the stages faster than we did last spring to the start of last summer, it's been so much harder second time around. But thanks to the sacrifices everyone has made, we're now on the first day of meteorological spring, approaching the finishing straight. And I'll now hand over to the Chief Executive to take us through how the guidance applies to businesses and what specific rules will be in place for those sectors that are impacted by them.
Thank you, Deputy Salisbury. As already stated, we are this afternoon publishing detailed guidance for all businesses. I would strongly urge all business owners and managers to review that guidance. Indeed, even the social guidance you've just been given, all this information is clearly laid out on our website. I will, however, cover off the principles of all businesses must adhere to, and so I will provide some information relevant to certain key sectors. But again, if you don't hear me reference your sector, please rest assured that you'll likely be able to find the guidance you need under the Clear Business section of our COVID website. This is a checklist to help all businesses understand their obligations. We've developed a set of principles that businesses must follow during stage 2. These include that staff should continue to work from home wherever it's possible to do so. However, your business can operate subject to certain mitigations and adherence to public health guidelines. The only exception will be nightclubs, which will not be permitted to open until stage 3. As Deputy Salisbury covered, this is a limit on the size of gatherings, and this also applies to businesses as follows: up to 20 people in an indoor working environment, up to 30 people in an outdoor working environment, no more than 10 people at a table for restaurants and cafes. The businesses that can demonstrate an operational need to exceed the limit of 20 people working indoors or 30 working outdoors may apply for an exemption to allow larger numbers to work on the premises, but these will only be allowed where a method statement has been approved and predicated upon the premises being of sufficient size and have the facilities to meet social distancing, adequate ventilation and hygiene requirements. Licensed premises and restaurants will be able to operate if they can provide a table service with food. Businesses will be required to keep records of everyone present on the premises, unless a business is operating in an uncontrolled environment, for example, and understandably a large retail store. This means employers and establishments must maintain records of people visiting the premises, including staff and customers, but importantly, delivery personnel and other visitors. Records should also be kept on the details of any off-site visits undertaken by staff. In the event that a positive COVID-19 case is identified and linked to a business, club or facility, there will be a requirement to immediately provide a full list of contacts. Businesses are expected to operate responsibly in the interest of the community as a whole, with a particular emphasis on ensuring all individuals displaying symptoms, however mild, should stay at home. And please note there will be a strict requirement for businesses to notify the States of Guernsey of their intention to operate in stage 2. If you've already notified us because you're operating in stage 1, then you don't need to do it again. This is for any business about to reopen as part of stage 2. The notification can be found on the business section of our COVID website. You can complete this now and formally move into stage 2. Now I will touch on some of the sector specific considerations, but this is not exhaustive. So again, we are providing the guidance early. Please make sure you read the guidance online and apply it to your sector. For office-based businesses, the key principle remains that they should work from home wherever possible. This is really important. Remember, stage 2 is a transition to total normality in stage 3. The construction industry can increase their level of activity as they'll now be able to have up to 30 staff working outside and 20 working inside. Building work and tradesmen will be able to operate within occupied houses, unless the workers attending or anyone living there has had symptoms consistent with COVID-19 within the last 48 hours. Anyone in the household is under a compulsory isolation order, or anyone in the household is considered medically vulnerable. This now includes trades such as carpet fitters, curtain fitters, or alarm companies, for example. Building wholesalers will be able to operate as long as they do so within the principles we've published. All public-facing non-essential retail businesses, including hairdressers and beauticians, may reopen, subject to continued cleaning, hygiene and appropriate social distancing requirements being in place. And restaurants, hotels, cafes, kiosks and pubs will be allowed to open to serve food, but only if they're able to provide a seated, table-only service, no standing in bar areas or serving areas. Social distancing and hygiene and cleanliness requirements in areas in kitchens. Licensed premises can only serve alcohol with food. We know the hospitality sector adopted these requirements so well in the first lockdown period, we are confident this can be achieved again. There needs to be at least 2 metres between tables. If possible, aim for 1 metre between people sitting at the table. Procedures will be in place for regular cleaning of toilets and restricting access to toilets where possible. Restaurants, pubs and cafes need to keep a list of people using their premises to include the tables each individual was sitting at and the timing of this. These records should be kept for 14 days. Al fresco dining is encouraged. Maximum again 10 per table still applies. And contactless payment is also encouraged. While there is a general limit of 20 people for indoor gatherings, I emphasise that for clarity, restaurants, cafes and pubs are permitted to have more than 20 people on the premises, dependent on the size of the premises and the ability to maintain social distancing and good hygiene measures. There must be no more than 10 people on any one table. This is, of course, is separate to the numbers of staff being up to 20 that you may use to run your premises. Hopefully that has given everyone a strong sense of what we're trying to achieve with businesses and how they need to operate. But there is a lot more information going up on the website, including further guidance for specific sectors. So whilst the CCA haven't approved our move to stage 2, we would hope it is a week today. But that is still to be time, but we're giving you plenty of time to read the detailed instructions and guidance that are available on the website. I would add one final point, especially to businesses. We are asking for notification that you are opening and operating to the requirements, not registration. This will hopefully allow for a smoother and quicker process than experienced during the last lockdown to allow you to operate once stage 2 comes into effect. Whilst we do have helplines open, we have limited numbers of operators available to answer queries from the entirety of all our business sectors. Experience has demonstrated that whilst there is much guidance available, some folk just like the comfort of someone else saying simply, yes, you can. I would encourage all to apply the judgment and safe practice indicated by Deputy Furbrush to the guidelines, which should see you being able to operate safely. Of course, if you have any outstanding concerns, the helpline will be there to assist you. I'll now hand straight back to Deputy Brouard, who will go through what stage 2 will mean for health and social care services and also areas such as private care homes. Thank you.
Thank you very much, Mr. Whitfield, and good afternoon, everyone. We will move to stage 2. There will be changes for both health and social care facilities and also at the hospital and also for private operators who run health and care services. I'm pleased to confirm that visitors will again be able to attend hospital to see friends and relatives. This will be for no more than 1 hour a day at a predetermined time. All visitors will undergo screening before entering the hospital to check for any COVID-related symptoms. Face coverings should be worn at all times, and while this may seem obvious, please do not, under any circumstances, attend the hospital if feeling unwell in any way or have any COVID symptoms. Unfortunately, this has happened in the past and it has caused us quite a few problems. Separately, our operating theatres at the PEH will open for all procedures, so elective surgery will resume. Those undergoing surgery will be tested beforehand and are advised to self-isolate for 2 weeks prior to the date of their procedure. Likewise, the day patient unit will be back to normal levels of activity. Face-to-face physio appointments will be able to restart in stage 2 for urgent cases, although remote and virtual consultations should still take place instead of face-to-face where possible. Most outpatient clinics will recommence and patients will be able to attend with one companion, providing they notify the health and social care services in advance. Community outpatient clinics will also be operating as normal. In terms of health and social care residential sites, including the Oberlands, one visitor by appointment will be allowed onto the ward or homes, and they will undergo screening on arrival. Face coverings should be worn and social distancing should be observed at all times. In terms of private health and care providers, dental practices will be open for emergency and essential care and will be able to offer some routine procedures. Please check with your dentist what services that they are able to offer. We know how difficult this period has been for individuals in care homes and for their families, and while private care homes may make their own decisions about how they wish to operate within public health guidelines, Health and Social Care has sought to work closely with homes since January to support their decision making. Currently, in stage 1, only end-of-life visits may take place. In stage 2, nominated visiting will be permissible, with one named visitor allowed for each resident as per the agreed pathway of the home. It will only be in stage 3 that life in care homes can return to normal and all visits can be allowed. If you have any questions about visiting a loved one in a home, the homes are very happy to assist, and as with the hospital, do not attend if you feel unwell. Before I hand back to Deputy Fairbrush, I just want to provide an update on the vaccine programme. Building on the guidance published by the UK's Joint Committee on Vaccination and Immunisation last Friday, Health and Social Care will be considering at what priority should be given for when we enter stage 2 of the vaccine programme locally and what that should look like. It will, of course, be many weeks before we are at that stage. We will be looking at both the scientific advice of the JCVI, which has rightly guided our approach so far, but also our particular local circumstances. Ultimately, we'll be looking to ensure that we continue to maximise the vaccines we're provided with to reduce the potential impact of COVID-19 on our community. We'll always be dependent on factors outside of our control, such as supply, but the efficient and effective risk-based approach, which has been adopted throughout the first phase of the vaccine programme, will continue to be central to the next. And just on the subject of vaccination for those with learning disabilities, which I know has been in the news recently, we have 230 identified people with learning disabilities that we will be contacting to arrange their vaccines. That's further to the 40 that we know who have already been vaccinated within the residential settings. We are working with the Adult Learning Disabilities team to ensure that the community vaccination centre is suitable for as many individuals with learning difficulties as possible. We will be offering specific clinics with reduced sensory environment and longer appointment times. Staff from the Adult Learning Disabilities team will be present to provide a known face for service users. If the COVID vaccination centre is not suitable for certain individuals, arrangements can be made for them to have their appointments elsewhere. We will be sending out invitations to these islanders to book their appointments within the next week or so. their primary carer will also be offered a vaccination at the same time. Thank you. I'll hand back to Deputy Fairbrush.
Thank you, Deputy Brian. In fact, thank all of my colleagues for their excellent contributions today. There is a lot of information. It is being published on websites, etc. Assimilate it, look at it, take note of it, follow it. And I just conclude, I'm not grumpiness again, just conclude by saying all stage 1 rules need to be followed until we are in stage 2. And when we are in stage 2, please follow those rules, because the sooner we can look backwards at this horrible virus and look forwards to enjoying our lives fully again, the better. But anyway, enough of me. Questions and answers, questions from the panel and answers, or the other way around really, questions from the media and answers from the panel. Who we got? Matthew Leach. Matthew, you first.
A question for Dr. Brink. Deputy Fairbrush mentioned this at the very beginning. Could we have an update on the variants of COVID? I know the Brazilian variant has been getting a lot of press in the UK at the moment, and whether or not we've seen any over here.
Dr. Brink, your mic.
Beg your pardon. The only variant we've seen to date over here is the B117, the Kent variant. We haven't seen any other variants, and indeed we haven't had any positive cases over the last 2 days. So we are pretty sure that the wave that we had was caused by the B117, the Kent variant. But obviously we need to stay vigilant. The identification of the Brazilian variant within the UK is clearly of concern and something that we need to keep a close eye on.
Thank you. Marina Jenkins from Channel Television. Marina.
Hi there. A teacher's got in contact with me saying that they are really nervous about heading back to the classroom next week without being vaccinated. Now, I know that there are the certain groups and you have said that you're going to be looking at them, but is this something that you might consider, vaccinating teachers and even perhaps teachers working with more vulnerable students first?
I think the answer to that is we've already said previously. I think Deputy Bride's got his hand up, but we're not going to be vaccinating teachers in phase 1. We are looking at, as Deputy Berard said, his committee in particular are looking at whether at the end of phase 1 teachers, police officers, etc. can be vaccinated then. But there are other safety measures. So I'm going to come briefly to Deputy Berard and then to Dr. Brink. I think in relation to health measures, she'll deal with the health measures for the teachers, etc., pending going back to school next week. Deputy Berard, is there anything you just want to quickly add?
Well, just quickly, just to confirm that, yes, we will be looking at the programme for phase 2. But of course, even the main programme won't start probably till May time, that we'll get through down to the 50-year-olds. But we've got no intention at the moment of bringing teachers more forward than that.
Thank you. And Dr. Brink, you've already given, I think, comfort to say what's going to happen with the teachers. But again, it's a very good question asked by Marina Jenkins. Is there anything further you'd like to say?
No, other than to say that we understand the concerns, and I think the other point that I'd like to make is we are aware of the constraints and the difficulties that teachers will face, which is why we've made guidance, for example, aim for 1 metre social distancing. So we've brought in all of that. We've got a testing programme as well. So it's a combination of all of this that will keep the environment as safe as possible.
Thank you. Drew Rebillard from Island FM. Drew, your question, please.
Good afternoon, panel. Drew Rebillard, Island FM here. I understand there are more announcements on the way over the next coming days, so perhaps we might have more light on this then. But following students in England going back to school from next Monday as well, some universities are also recommencing in-person teaching for some of their courses. Now, that requires some students who are currently residing in Guernsey to travel back to England. Are there any provisions in place for those students who are required to travel back to the UK to their respective universities in order to recommence that face-to-face teaching from the 8th of March? And particularly, is there any help there available for those islanders studying further up the country? As I understand, Guernsey's only operating essential flights to the south.
Obviously, that'll be kept under review, but I believe those students will be able to travel. Perhaps I look at Mr. Whitfield, if he could say what provision could be made in relation to students having to go back from the 8th of March or shortly thereafter.
I mean, I think this work is ongoing. I know some students have returned already, but in terms of comprehensive arrangements. We're still liaising, and education is liaising with universities and students that are going that want to go back to see what requirements we can assist them with. But I think it's something we probably want to come back once that picture grows and we can provide more information on it.
Thank you. Penny Elderfield. Penny, your question, please.
Yes, two parts to my question, if that's okay. The first is, I know there will be some parents that are unsure about sending their children back, perhaps, for instance, if they've got vulnerable family members. What stance will education be taking with regards to compulsory attendance? And I guess, what would your advice be to families that do have vulnerable members about the risks of going back to school?
Definitely deal with because we're going to have education on later in the week, as I say. And we will be able to update again, as you've appreciated, on Wednesday. But I don't think anybody's going to come down on anybody with an iron fist, really, in relation to compulsory attendance. We want children to attend, young people to attend, but I don't think there's going to be any figuratively taken aggressive action in that regard. Dr. Brink, you had your hand up.
Just to also say that most of those vulnerable people will now be immunised. So we've done the clinically extremely vulnerable group, we've done all the age-based, the older age groups. So those groups, we should have immunised the majority of those. If anyone's been missed out, please do let us know. But what we have seen in this way is we've seen the impact of the vaccine in protecting those most vulnerable in our society. So I'd encourage everyone to take up that offer of the vaccine.
Thank you very much. Very sensible advice. As I say, Her Majesty given that advice, so Dr. Brink, who's our equivalent of the same, has given that advice. But have you finished your question, Penny? If so, I'll pass on to Juliet.
Yes, that's all from me. Thank you.
Thank you very much. Juliet, your question, please.
Great. Thank you very much for the guidance you've sent out to the media, which we'll obviously be publishing shortly. I didn't see much mention about the College of FE and preschools and nurseries. How are they fitting into the bigger picture?
Well, they'll be able to open as again from next Monday, and it'll be the same kind of arrangements for protection, for testing and everything else in relation to whether you're talking about a 2-year-old or a 19-year-old. It'll be the same kind of arrangement in relation to that. I don't know if there's anything you want to add, Dr. Brink.
No, we've got an intensive testing program going on. We've done some over the weekend. We're doing large numbers over the next couple of weeks. After that, we're bringing in a lateral flow program. So there's a huge program of testing that we're putting behind the return to school.
Thank you. Marina Jenkins, Deputy Salisbury.
Thank you, Peter. I just think it's important to reiterate and just give comfort to people to know that we're opening the schools because we think it's safe. We wouldn't open them if we didn't think it was safe. We've got a lot of interventions we're putting in, and as Nikki has just mentioned about the testing regime as well. So it's not something that we would just do just to make it easier, make people happy. We're doing this because we know it's safe to do it.
Indeed, and I emphasise that point again, as my colleagues have emphasised it. Safety is paramount. That's the first consideration. Marina, your question, please.
In terms of sports in phase 2, in stage 2, will close contact sports be able to resume, like things like football and hockey? Any details on that one yet?
Well, I think you've seen both Deputy Salisbury and Dr. Brink almost in tandem, really, synchronised head swinging, saying no. But I think Deputy Salisbury had her hand up, wanted to add something to that.
Yeah, no, I mean, as I said earlier, non-contact sports, no, you can't, but you can train in an environment, but keep that distancing, as we've said, in an outdoor environment. But no, non-contact, only non-contact sports at the moment.
Thank you. Drew Rebillard, your question, please.
Thank you, Deputy Furbush. Initially, there were talks about the possibility of a staggered return of students over a week-long period. Now, what are the reasons for opting to send students back over 2 days instead?
I think it's simply that it felt it could be done, it could be achieved in that form safely. It was thought, you're absolutely right, it was thought perhaps it should be staged over, 4 days a week, whatever. But the decision after discussion between Public Health and the Education Department and relevant officers was that it could be done in the 2 days that I've already mentioned. Juliet, your question.
Last week, the panel very kindly gave us an update on how the registration of not ordinarily resident islanders was going on and how they were going to hopefully fit into the immunisation programme. It's been mentioned during this press conference that everyone in high risk groups have now been, in older age groups have now been vaccinated, but we've been contacted by people in their late 70s and in their 80s from this group who've still not heard anything from the vaccine team apart from hold tight, we'll be in touch. Yep. Do you know when they will be in touch?
Dr. Brigg.
So perhaps just to clarify, I was referring to people that have been called in through our vaccination programme and not to this other group of individuals. I'm not sure if Mr. Whitfield's got an update on that, but my understanding is that they're gathering that data and will call those people in when there's slots available on the programme.
Thank you. Do you want to add anything, Mr. Whitfield? Paul?
No, I think that's exactly how we now know what we're working with in terms of numbers, just short of 200. And obviously they're broken down again, reflecting against the categories of vaccination. So those will be reintroduced, but they'll also be introduced along our scheduling because people have already got appointment letters. So they'll be scheduled alongside that at the same time. So some of those might take slightly longer as they're fitted into the scheduling.
OK, but I think the point in relation to that is that it's not whether they will get vaccinated, they will get vaccinated. It's just fixing those dates and times. But the intent is to do it as soon as is reasonably practical. Penny Edelfield, your question, Penny.
Yes, you've mentioned already about testing within education settings moving forward. Are there any other sectors that you'll be focusing on with surveillance testing as we start to see other businesses open up when we move to stage 2?
Thank you. Dr. Brigg?
Yes, absolutely. So we have a testing strategy which focuses on 3 things. It focuses on the testing of symptomatic people. It focuses on our surge testing, where we identify an area of concern and we put additional testing, and it focuses on our surveillance testing. Our surveillance program is already established, and we've been testing groups such as the bailiwick law enforcement, teachers, various cleaning services, delivery drivers, so a number of people we've already been tested. We're pulling this forward now into a formalised programme. So the surveillance programme initially was quite reactive, so we're reacting to areas of concern during the second wave, and it's now moving over into a proactive programme where we're doing an evidence-based analysis of particular areas that are potentially at higher risk. And those people are now being brought forward to testing. Most of them are being done through the East Arm, with a PCR-based assay, but what we will be doing in the next month is phasing in a lateral flow testing, which will sit alongside the PCR-based assay, and that forms an integral part of our exit from lockdown.
Thank you very much. Juliette Puto, your next question, please.
Yes, we've heard from fishermen that they've obviously been quite keen to land their catches in France in a contactless way, which I know has taken place in the past. I haven't seen any detailing of that in the stage 2 strategy. Is it hoped that they will hopefully be able to land their catches if they can do it safely in the next stage?
I think it's going to be, I'm not sure that actually is going to appear in any particular detail. I'll ask Paul Whitfield in the guidance that I have read. Got to be careful in relation to France, because France doesn't have a detailed, seemingly, there are numbers of people in France who are not going to undertake the vaccination programme. Very unwise, but that's their decision. But anything, Paul, that you want to add?
No, only that it is currently being worked on as we speak. And of course, last time we did have really good operating method statements were followed by the fishing industry, worked really, really successfully. So they were able to take to their catch without landing shoreside and returning back, which worked really well. So I'm hoping we're going to be able to put very similar arrangements in place.
Good, thank you very much. Matthew Leach.
We've had a lot of messages in the last half hour from the public, re the stage 2 guidance that's been outlined today. One common request for clarification is in regards to the bubbles and gatherings. So what is an example of a social event where 20 people can gather inside, and how does that differ to household bubbles?
Well, because the 20 people would be, that's not necessarily, 4 households might be 11 people, it might be 24 people. It just depends. The 20 people in the social gathering inside is different, but I see Paul Whitfield's got his hand up, so off you go, Paul.
Well, just to help clarify that, obviously, if you've got a large building where you can safely gather or have an event with 20 people, it could be following a wedding, for example, but you're in a large, say we were talking about St. James. One of the highest concerns that has been really prevalent in this particular wave is the close proximity, and particularly in the domestic house setting. So this is why there's quite a lot of emphasis on outdoor numbers, and in larger, more ventilated buildings are less of a risk than in the domestic setting. But I don't know if Dr. Brink would add to that.
That's exactly correct. So within a household, you get people together with no social distancing. So the household bubbles, the 4 households, will essentially act as one household. When you're looking at a controlled environment gathering, you're looking at a gathering in a particular situation where you know who's there, you have all of their contact details, people will socially distance by a meter. So that is a different event to what would happen within a household setting.
Thank you. Back to Channel TV's Marina Jenkins for her next question.
Are there any updates on whether the CCA is considering a quarantine hotel in Guernsey?
That's been under discussion for weeks, I think, as my colleagues, you can see, Deputy Salisbury, Deputy Burrard agreeing. It will be under consideration again. It is an issue that is going to go away. Deputy Salisbury.
Yes, thank you, Peter. I think it's coming more to the fore as we open up borders more, and we're considering more people coming through. And we thought at this stage it wasn't as important as trying to manage lockdown and what was happening on island, because we were having on island transmission. As our concern gravitates more towards the borders of people coming in, that's when we're thinking about bringing in quarantine hotels. And yes, we are actively considering it at the moment.
Indeed. I don't see any other. Yes, sorry, Marina, come back again. Yeah, next question.
I suppose leading on from that then, a question from a couple of viewers. Many islanders, both in the UK and in Guernsey, haven't seen their loved ones, in many people, in over a year. Yep. This particular viewer contacted me to say that because they've got livestock, it hasn't been feasible to isolate for 2 weeks in returning Guernsey. Obviously, this is before the lockdown. And they asked, whether they say these unsustainable border restrictions are going to cease, when they're going to cease, or at least reduce for some areas in the UK where there are, much lower rates of the virus, like in the southwest. And indeed, if people have been vaccinated, the risk of them, travelling might be lower. So I know last week you have said that is obviously something you're looking at, but I think whilst Guernsey is ever getting in a better position case-wise, more people are wanting to see their loved ones and family. And so where are we on that?
Thank you. Very understandable from both your question and from the people that have contacted you and people have contacted us. That is under active review. As I said last week, we are expecting a paper sometime during the course of this week, which we'll address either tomorrow if we get it in time, or if not on Thursday. That doesn't mean there are any instant answers, but it is something that we are very, very alive to. I don't see any other member of the media with their hand up. Just making sure I haven't missed anybody. I don't, so I don't think I have missed anybody. So I thank the media for their questions. I thank everybody for their attendance, my colleagues for their attendance. And again, we're meeting at CCA tomorrow. We'll have more news for you on Wednesday. Thank you very much indeed.